Hi everybody, my name is Shanivi Srikonda and I am here with Dr. Julie Trivedi from UT Southwestern. This is a COVID-19 Q&A. We're so glad to have you. Thank you so much for joining us.
Thank you for the invitation. It's an honor to be able to be here.
Yeah, thank you so much again for joining us and being here. So we're going to start with the basic symptoms of COVID-19, the virus. So what are the symptoms of COVID-19 and how long does it take to develop these symptoms after you've been exposed to the virus?
Yeah, so the incubation period is 14 days. So that's the time during which, after you've been exposed, most people usually develop symptoms by. What we usually see is anywhere from day 2 to day 5 is when most individuals have developed symptoms. The main symptoms that people experience are fever, cough, shortness of breath, anosmia, which is a loss of sense of smell, and then also other types of non-specific symptoms such as muscle aches, headache, runny nose, sore throat, and then sometimes nausea, vomiting, or diarrhea.
Thank you so much. So can you be asymptomatic?
Yes, this is something that, had been a controversy throughout the whole pandemic, trying to understand, when symptoms start, does everyone develop symptoms, and how long they might be infectious for prior to symptom onset. So yes, there are certainly individuals that have tested positive for COVID that have never reported any symptoms, which is an interesting feature of this viral infection. And the concern is that these are the individuals that could be then spreading infection to other people because they themselves don't know that they're infected and harboring this infection.
So now that flu season is almost here, the winter is almost here, can you talk a bit about COVID-19 versus the flu?
Sure, absolutely. This has been another big topic that has come about. So COVID-19 is, the way it's similar to the flu is that it is a respiratory virus. It's a virus that infects the upper airway, the nose, the lungs, and that's probably where the similarities end. What we've seen with COVID-19 is that people can be infectious for about 2 days prior to symptoms starting. We're seeing a wider variety of symptoms that people have presented with, especially this one of the loss of sense of smell. That is pretty unique to COVID-19. And then the way we're seeing COVID-19 manifest in our patients has been really interesting as well. Some people, again, like we mentioned, not really having any symptoms, but then others becoming really severely ill, needing to be in the hospital, and unfortunately, many people even dying. A lot of different other types of complications from the infection itself that we have seen, such as, fatigue that has been lasting for a really long time. People have developed blood clots, and sometimes people have had organ failure. The other thing about COVID-19, it belongs to this group of viruses called coronavirus. Coronaviruses, there are ones that circulate every year during the winter season, and these are just part of the regular common colds that people have. But it has also been identified as a cause of the outbreak back in 2002 with SARS, and then in 2013 with MERS in the Middle East. So occasionally there will be a specific strain of a coronavirus that mutates, that changes over time, and then can cause much more widespread infection. The downside of COVID-19 is that none of us have really been exposed to this virus prior to this pandemic starting. So none of us have any type of immunity that's been built up over time. Whereas with influenza, many of us may have experienced the flu, and of course we've had vaccines available for many years. The vaccines themselves cover multiple strains of influenza, of both influenza A and B in there. And, so in that sense, we have known things that can protect us against infection, like the vaccine. And then, of course, we have some readily available medications like Tamiflu, which can also help to treat. Influenza itself usually lasts around 2 to 5 days. And after 5 days, people are usually better, are able to come back to work feeling okay. And they're usually infectious for maybe about 3 days before their symptoms start. But it's a pretty narrow window that they're experiencing symptoms, and then most people do recover. Unfortunately, we do sometimes have patients that have another pneumonia that can settle into their lungs on top of flu. And of course, we do have some individuals who have died of influenza, but not currently at the numbers that we have seen with COVID-19.
So thank you so much for giving us the background about COVID-19 and the way that the virus works. So knowing all of that, how do people protect themselves and their families from the virus? How is the virus spread?
Yeah, so the virus is spread by, what we call these droplets or these aerosols and particles that are found in our coughing, sneezing, and even things like singing. There's been reports of people at choir practice and then many people becoming infected afterwards. So essentially, it's the particles that are released from our lungs and our mouth and our nose that contain the virus in there that can then infect other people. What we can do to help protect ourselves then fall into some basic categories of what we call non-pharmacologic intervention. So these are things that we can do to protect ourselves that don't require medication. One of those, and the most important thing, has been wearing a mask. And what that does is that helps to protect you against inhaling any of these droplets or aerosols from the people around you, but then also helping to prevent you, in case you're infected, preventing you from shedding this out into the environment. So that's one of the biggest things that we can do. The other is what we refer to as the social distancing or physical distancing, trying to minimize the amount of interaction that you have with people that are not from your family or your household. Specifically because you may not know if they are infected, if they could be harboring virus, and then shedding that into the environment. The other is that, trying to maintain a distance of 6 feet. What is the magic about this number of 6 feet? Essentially, the droplets, when you cough them or express them, most of these heavier ones settle down to the ground within 5 feet. There are sometimes some that stay suspended in the air, but that's kind of where the 6 feet of distance kind of came about, that should be far enough that if somebody coughed or sneezed, hopefully you would not have anything directly spraying on you. And then the last component is hand hygiene. So always washing your hands with soap and water or an alcohol rub if you don't have soap and water, making sure that you don't touch your face, you don't touch your nose and your eyes after touching things in the environment, because that's how you can then contaminate yourself and get infected. So those are the main 4 things.
Thank you so much. So in line with going over these different steps and components to protect yourself against the virus, what are some recommended masks and PPE that we should wear, that we could wear to protect ourselves from the virus better?
Yeah, currently, we're pretty fortunate that there are so many different types of masks available in the market compared to maybe 4 and 5 months ago. Mm-hmm. Sometimes, though, this can make it a little bit more challenging to figure out what is the right type of mask to buy. There have been some recent studies that have come out looking at the effectiveness of different types of masks and the materials that they were made out of. And essentially, one of the best things that you can do is to buy one of these cheap, easily found surgical masks. So these are the masks that many grocery stores are selling, and the advantages of them are that they're easy to find. They can be discarded right away after you've used them, so you don't have to worry about washing them and potentially re-exposing yourself or contaminating yourself. So surgical masks are the best way to go currently. After that, looking at cloth masks, what we really recommend are that they have at least 2 or 3 layers of material. Sometimes some of them have a built-in pocket that you can put some of these specialty filters. That works as well. But having 2 or 3 layers is going to be much better than having a mask that has only 1 layer of cloth. The recent studies have also shown that masks made out of fleece might actually be worse than wearing no mask, because it can harbor a lot of the virus, and then people may not be washing them routinely. There's also been some concern about the neck gaiters, which are those scarf types of things that can be used to cover the mouth. The study that came out looked at those neck gaiters that were made out of fleece. So hard to know whether the gaiters themselves were a risk, or whether it's the material that it was made out of. But I think the bottom line is trying to get a mask made out of 2 or 3 layers of material. If it's a reusable mask, making sure you wash it and that you rotate it out with other masks as well. And then the second component would be eye protection. So if you are in an environment where people don't have masks on and you might have to be closer to them than 6 feet, having something to protect your eyes will be very instrumental. Many people have face shields, which I think you can even buy off of Amazon now. And those are those clear plastic covers that come down and cover your face. And then sometimes you can get the goggles that we used to use in like chemistry class that protect your eyes as well. And this can be helpful if you are, let's say, in an area where people might be taking their mask down to eat. Maybe you're on a plane or traveling in another area. Having eye protection and a mask can really protect you against other individuals who might have COVID.
Thank you so much. So in terms of treatment options, what are some immediate treatment options after someone has tested positive for COVID-19?
Yeah, so, the treatment really for COVID-19 has largely been supportive. What that means is, if you have a fever, you can take medication to help your fever or headache or muscle aches. Trying to stay hydrated. If you have nausea or vomiting, maybe getting some medication that might help with that. So if you have symptoms and you've recently been diagnosed with COVID, those are going to be the most immediate things that you are able to do for yourself. If you become ill enough that you end up in the hospital, there are other types of treatment options available. And then there are many clinical trials that are ongoing, looking at different types of medications, both as an outpatient and as an inpatient. So if you are hospitalized, depending on how severely ill you are, you might qualify for a medication called remdesivir. This has been in the news lately, or at least for several months at least. This drug was originally formulated for Ebola and has actually been found to have effectiveness against COVID-19. The clinical trials that have been ongoing are looking at remdesivir in combination with several other types of medications. So there have been multiple trials, the Act 1, Act 2, we're currently on Act 3. And this is looking at remdesivir with another medication called interferon beta. There's been some role of steroids for people who have required a certain amount of oxygen and are in the hospital. They might benefit from a course of steroids for about up to 10 days or so to help minimize some of that inflammation response. And then there's another medication in an outpatient study called colchicine. This is a medication that's been used to treat gout. And again, the main crux of all of these medications, outside of those that are specifically targeted against the virus, the main crux of all of these medications is to help to kind of tamper down the immune response to this virus, since many of the complications that we have seen are not from the actual virus itself, but rather the way our body has reacted to having been infected with the virus. So many clinical trials, not any drugs currently that are fully FDA approved outside of some of these clinical trials. And of course, with remdesivir, we have the emergency use authorization for that medication.
What about some longer term treatment options or possible new treatment options that are available on the horizon, perhaps?
Yeah, unfortunately, we don't know too much about some of these longer term treatment options. Many of these medications that I mentioned are really given for a defined time period of anywhere, usually from 5 to 10 days. Sometimes there's multiple doses involved. Some of the treatments on the horizon, actually, other clinical trials are looking at something called monoclonal antibodies. And this is similar to the antibodies that would be found in the convalescent plasma. Convalescent plasma is essentially receiving antibodies from someone who already had the infection to help you when you have been recently infected. So there was a recent study showing that it might be beneficial in people who receive convalescent plasma in the first 3 days of diagnosis as opposed to after that. So the monoclonal antibodies are kind of a slightly different version of these antibodies. And antibodies essentially are the proteins that your body produces when it encounters a new virus or a bacteria to help fight that off. So that's really the target of some of the newer treatments that are out there, looking for ways to help the immune system to overcome the virus early on in infection.
Thank you so much. So now I think we can get into a bit of the effects of the virus. So what are some both shorter term and longer term impacts that COVID-19 can have on the body?
Yeah, this is something that we've continued to learn about as time has progressed. One thing that has been really interesting about this is the way it has manifested in different people. We've seen such a wide range of symptoms and even how severe some of those symptoms are that, every day, I remember for a while, it was every day there was something new that we were learning. And just when we had seemed like we figured it out and we could sail on this clear path, something new would change. And then we'd have to, rethink our strategies. What we've been hearing about are some people who, especially those who are asymptomatic, are completely fine, totally feel great. The people who have anosmia, that loss of the sense of smell, we've been hearing reports that this can linger around for a while, even several weeks to several months. People who've had more serious infection, we've been hearing can have that fatigue, this deep type of fatigue that has settled in, that is still persistent over a long period of time, weeks to months. We've seen reports of these multi-system inflammation disorders. We've been hearing about this in children as well as in adults. And we've been hearing of patients coming back in with blood clots. There was that term of COVID toes. So these unique findings of, when individuals might have blood clots going to their lungs or other parts of their body. And so essentially their blood supply becomes inflamed, and that's what predisposes them to developing some of these clots. So many types of long-term side effects that can be seen when your body is in this heightened inflammation or inflammatory state. I saw a recent case report of a case of myasthenia gravis being diagnosed or detected in somebody who had recently been infected with COVID-19. And I think, when I think about this virus, what it seems like it does is that it really sensitizes the body and kind of puts that immune system on high alert. And there might be people who might have developed some of these autoimmune conditions anyway, but that maybe having COVID-19 has kind of, accelerated when they develop symptoms. So it's something that we're continuing to learn about how this is impacting body over the long term.
Gotcha. Thank you so much. So now we can go into a bit about COVID-19 myths busted, kind of like a Mythbuster segment. So first, does COVID-19 only affect the elderly, or are young people also susceptible?
Definitely affects everyone. We have seen older people get infected and survive. I recently heard a story about a woman who survived the Spanish flu in 1917 and also survived from coronavirus. So she's 107 years old. And we've heard about, 20 and 30-year-olds who have had no medical conditions who have unfortunately died from this. So, what we do know is that age tends to influence how severely ill someone might become, and also how likely they might be to actually die from this. So, when we had patients coming into the hospital and looking at the cases, let's say in Dallas County, the majority of cases at some point were not in the people who were over 65, but yet the people who were over 65 were making up 2/3 of all of the people who were dying from COVID. So we certainly know that being over the age of 65 puts someone at risk of having more severe illness, as well as does having any types of other underlying medical conditions, such as being obese, having diabetes, high blood pressure, and having underlying lung disease. So these are things that might make someone have more severe illness compared to someone else. And those things, of course, can happen regardless of whether you are old or young. More recently, we have been seeing and hearing about stories as far as children are concerned. When you look at some of the numbers in Dallas County, actually, just in the week from August 6th to August 14th, we've had several hundred children test positive for COVID-19 between the age of 5 and 18. And since July 1st, there have been over 3,000 children who have tested positive. We've seen a small number of those who've had to be hospitalized. So only about 66 out of those over 3,000 children ended up in the hospital. So that kind of points to that if you are younger, you're probably not likely to have a severe disease. You know, you might have more milder symptoms, if at all, but not to say that we haven't seen deaths in children, not just here in Texas, but in other states and in other places around the world as well. So definitely something for people of all ages to be mindful of. And, you know, when we think about, you know, our 20 to 40-year-olds, you know, the group that likes to go out and socialize, and, you know, now that colleges are back in session, you know, these folks, if they were to become exposed to COVID-19, even if they became infected, may do fine, but they might come home and visit their parents or grandparents or another family member who then becomes ill and then doesn't do fine. And I think that's where it's, you know, our responsibility that even if we think we might be okay, we need to be mindful of the people around us and our family members to make sure that they would be okay.
So some people claim that eating certain foods like garlic or bell peppers can prevent COVID-19. Can you go into why this is a myth?
This is a great question, because my dad was saying similar things too. You know, they see these videos on WhatsApp and YouTube, and it's like, oh, if you eat garlic every day, you'll be fine, and, you know, it'll get rid of the COVID from your nose. And, you know, a lot of these ingredients that we use, or different types of other foods, many of them they're good for you. I mean, they're good for your body, they're good for your health. They have anti-inflammatory properties, but, you know, they are not targeted against the actual infection itself. So, you know, when we think about these other fruits, vegetables, herbs, you know, yes, it's good to incorporate that in your diet. It's good to eat a healthy, well-balanced diet, making sure you get your fruits and vegetables and fiber. But really, these don't serve as a replacement for, you know, the treatments and the medications that you might need. Meaning, eating garlic every day is not going to put more oxygen in your blood if your lungs are so inflamed from having been infected. So certainly incorporate that in your diet, but I think it would be really not a good idea to think that these alone are going to protect you and prevent you from, you know, getting infected.
Do vaccines against pneumonia protect against the virus?
So I'm going to say the direct answer to that is going to be no. But, you know, I'm glad that you mentioned vaccines, because I wanted to talk about that as well. So, you know, whatever we can do to help stay healthy is going to be really important. You know, this is a time when many people didn't get a chance to see their doctors in person. A lot of these visits were done through virtual means. And so many children may not actually have received the vaccines that they normally should have. So we know that vaccines help keep our public healthy. They help keep our children healthy, and even us as grown-ups, and especially those who have certain types of underlying medical conditions. There are vaccines that protect us against viruses, and there are vaccines that protect us against different types of bacteria. The pneumonia vaccine, to which the question is alluding to, is a vaccine that protects against strep pneumo. So this is a bacteria that can cause pneumonia, it can cause meningitis, it can cause infection on the heart valves. And people who have diabetes, people who drink a lot of alcohol or have cirrhosis, people who have asthma or other types of lung disease, they might be more susceptible to having pneumonia due to strep pneumo. There are 2 vaccines for strep pneumo itself, and they cover different strains, different amounts of strains of the bacteria, and they will protect you against having that particular pneumonia. They're not going to protect you against having COVID. But it would be good such that if you did become infected with COVID, that you don't then develop a secondary infection with one of these other bacteria that can be vaccine preventable. The other, vaccines that are there are what we kind of mentioned earlier for the flu vaccine. And, it's about to be time for people to receive their flu vaccines. Many pharmacies have begun stocking this. There are currently 4 strains of flu that are incorporated in the main flu vaccine that's administered. And these are vaccines that are essentially tailored every year based on the strains that are circulating in the Southern Hemisphere. So when we have our summer, Australia has its winter. So we monitor what types of flu are circulating in other countries, and then we're able to incorporate those strains when we make the flu vaccine for the US and the Northern Hemisphere. So this is something that can change often year to year. It covers against influenza A as well as influenza B. And, many of us heard about H1N1 that came out in 2009. That has also been included in the flu vaccine. So when you get your flu vaccine every year, you help to actually build up kind of, it's like a collection of books that you might acquire. You help to build immunity over time to several different strains of viruses. And while the flu vaccine may not be 100% effective, even it being 20 to 50% effective means it's going to reduce how many days you might be sick for. It'll reduce how sick you get so that you might actually only have a common cold and not actually need to be in the hospital. And it might keep you healthy enough so that you don't actually get infected with any other types of bacteria. So, those vaccines don't protect directly against COVID-19, but they kind of work hand in hand to protect you from other things that are circulating. And on that note, there's been a lot of movement in the research arena when we think about vaccines for COVID-19. There are over 140 different vaccines in various stages of development in the market. Currently, about 135 of them are in this what we call preclinical phases. They're still being developed, looking to see if they actually work. And then, as they start to show promise, they're tested to see if they actually generate the intended effect, which is the immune response. They look for safety to see if, people are having any types of bad reactions to the vaccine itself. And so there are some that have now moved into phase 3 clinical trials, one of which is with Janssen. And this is going to be enrolling about 30,000 patients in the United States pretty soon, within the next few weeks or so. And, UT Southwestern will be participating in that study as well. So there's only been one vaccine so far that has been approved, but this is currently in China with a very specialized application as far as who would benefit from receiving it. The government has been, our US government has been very heavily invested in assisting the whole vaccine process and providing extra funding to companies to come up with novel ways to develop a vaccine, as well as helping to make sure that when we do have a vaccine, we're able to manufacture it and then actually distribute it to, the over 300 million people that live in the United States. So all of that goes into some of the vaccine development as well.
What about COVID-19 and cold weather? Can cold weather or snow somehow kill the virus?
So I'm going to say the answer to that is no. And kind of similar question on the flip side of that had been, how about COVID-19 and then hot weather? Mm-hmm. What we have seen is that this is a virus that many of us had not been exposed to. We saw it when it started. It started out in the winter time in many states and many countries around the world. So cold weather is not something that will get rid of COVID-19. And same with hot weather. We've seen many places, including our own area here in Texas, where we've had 105-degree heat, where we're still seeing the virus. That being said, UV light is something that is effective against the virus and has been used in hospitals and in select situations to help, maybe clean the environment, if somebody has been in that room who previously had COVID-19 as part of the whole cleaning process. So there are some technologies that incorporate UV light with that. What we see with the cold weather, though, is that people start to congregate indoors more. So as it becomes too cold to go outside, you're going to have people inside. And when people are inside and in closer quarters, that's when you might have, more transmission of respiratory viruses, which pretty much explains why we see the patterns we see every year.
So now we can talk a bit about the research surrounding COVID-19. Can you give us a brief summary and talk a bit about the current research, the current state of research into COVID-19?
Yes, there has been so much research going on, tens and thousands of articles that have been published. Hard to sometimes sift through all of these to see what is important, what might actually be accurate. And we've certainly heard about some controversies in the news about some studies that have been released. There are different categories of research that are going on relating to COVID-19. One would be looking at some of the epidemiology and transmission. So thinking about how it might spread from one group to another, how it might spread in different settings like schools, churches, choirs, restaurants, looking at the effectiveness of different types of masks or PPE. So a lot of research going into that part of it. Other parts of it are looking at potential treatments for COVID-19. So looking at some drug targets, when this virus was first identified, there was, its whole genetic sequence was released very quickly, made available on the internet, which, of course, is a benefit of modern day science. And this really made it possible for many people to then, many labs and research centers to try to see what types of medications we already have out in the market that might then be effective against this virus. And that's how we've identified remdesivir, that's how we identified atovaquone. So some of these medications that might have activity against the virus itself were identified this way. And there are continually, new drugs being developed as well to look at how it might affect whether or not this virus can actually infect the person, or whether it can modify how much damage or inflammation that this virus might cause in someone. So a lot of movement also on that treatment front. And then, the other part, as we kind of just mentioned, are about vaccines. So there's a lot of studies, a lot of research going into the development of vaccines and looking at different ways to be able to generate a protective response in someone. So, we think of traditionally like the flu vaccine, but there are many different other types of molecules that can then help, might potentially help protect someone against COVID. And then the last part of it is, I was just thinking about this for a second, I forgot. I'll have to get back to that in a minute. But I was gonna say, one of the other areas of research are looking at cleaning and disinfectant products, what types of materials might be effective to be able to get rid of COVID-19 in the environment, and things like that. So things that we could maybe use in our own homes versus in the hospital. So yeah.
Thank you so much. So I just want to take a little bit of time to highlight some local Irving COVID-19 resources. If you go to the City of Irving's website, there are COVID resources that you can contact there. Specifically, you can go to cityofirving.org/3605/community-resources to get an array of different support services and ways that you can be supported for both individuals and families during this time. Thank you so much, Dr. Trivedi, for joining us and for answering all of the questions so well. It was really educational, and I just want to thank you so much again. And yes, thank you again.
You're welcome. It's really a pleasure to be able to do this. I think that the more we're able to spread information and correct, reliable information about this, more helpful it is, because there's so much out there. Sometimes it's hard to make sense of what to believe and what not to believe. So thank you so much for doing this. I think it's a great initiative.
Thanks again. Thank you for joining us. Thank you everybody else for also joining us and tuning in and watching this. Stay safe, everybody.